Mr. President, hello. My name is Jeri Winslett. My husband is Walter. I have a son named Mark, and we've always had insurance. We've always carried insurance because it's the right thing to do. We're responsible, and we've struggled since we're self-employed to try to make those payments that keep going up no matter what. We've worked hard, and it hasn't seemed to pay off one way or the other. Our insurance has always seemed to win. They always get the better of us. We're paying huge amounts for nothing right now. We opted for the health savings account because we figured that was one way to put money into something. If we were going to put it into something, we should put it into a savings account. That way we can drop out of it as we got older maybe, and we hadn't used it since we're all healthy. And that was a really good idea for a couple of years. It also started out with a very low premium and a very high deductible. So we were paying about $250 a month with a $10,000 deductible. We never used it. We were able to save some money by not paying a high premium. So the premiums keep going up, and yesterday they went up again, another 25%. So we're at $530 a month now. And unfortunately, a couple of years into having a health savings account, our son, who was a junior in college at the time, contracted Lyme disease, and it was undiagnosed. We have spent 2.5 years trying to figure out what's wrong with him. We've seen specialists who, because we live in the part of the United States that does not have much Lyme disease, weren't knowledgeable. The tests that we were instructed to take for it, since we knew that when he was in Pennsylvania, he had been bitten by a tick. That's one of the little indications that we had that maybe it was Lyme disease. There were a lot of other things that were going on with the system though, and so we weren't sure. And none of the doctors knew any test except the one standard, which is more likely than not very reliable. It's 60%, I think, of the cases are not detected that way. And since he had none of the symptoms, then we weren't sure that that was what it was, especially when it came back negative. So we went on to the other things. All the while the insurance was not paying anything towards any of our bills. They were negotiating with physicians, they were negotiating with labs, and lowering the prices for us. But that's something that if we had been paying cash, we would have gotten lower prices as well, and not had to pay a premium every month on top of it. We've been very discouraged by the healthcare system. We've been discouraged by the doctors. There's a few specialists out there that really know what they're doing, and until you find them, you're going to spend a lot of money, and you're not going to have much help with the insurance. So what happened with our son is that he had to drop out of school, and he wasn't able to finish yet. He's still on leave of absence. This is the 3rd year now. And we tried to lower our deductible on the health savings account to see if that would help. But when we called the insurance company, they informed us that if we were raising our deductible, there'd be no problem. If we're lowering it, we're going to have to reapply. So we knew that they would be suspicious at that point, and that if we put down that Mark had Lyme disease, they would not cover him. So we're sort of stuck between a rock and a hard place where we're having to keep this insurance that we have. We're having to keep it at a very high deductible. We're not getting anything from it. We're paying in, and we're not getting anything back. It just doesn't seem fair. We aren't freeloaders. We don't care to be freeloaders, but for listening to me, and I appreciate what you're doing in Washington I hope that this healthcare plan goes through. We're out there rooting for you and really looking forward to the day that we can relax and get our healthcare done in the respectable way it needs to be done. Thanks again.